Okay, Christine, I want to thank you so much for joining us here on the Your Birth Network podcast. I am so excited to share with everyone who you are, what you do, and your birth story. So, why don't you just take a moment and introduce yourself to everyone? Say a little bit about you personally and your business and whatever else about your life you want to share.
Okay, great. Well, thank you so much for having me. My name is Christine Robinal. I am a physical therapist. I work with kids, but I am also a mom to three children. But I've had five births. So, who I am, I want to help all families just kind of understand their kids better. And so, as a pediatric physical therapist, I get to do that, and I do have some coaching and mentor stuff for other pediatric physical therapists. So especially
Nice.
now in the time of COVID and telehealth, I'm doing a lot of stuff online. So that's who I am.
Wow. How did you get into physical therapy, specifically pediatrics? Because that's a really like small specialty, right?
Yeah, definitely. There's a
Mm.
smaller group of us who are doing that. I think I've always
Yeah.
wanted to work with children. When I was younger, I babysat, from the age of
Oh,
10. I was, thinking about it now, like would I let my 10-year-old babysit? Well, yeah, actually I would let the 10-year-old babysit, not the 8-year-old. But so I've always done that. I enjoy play.
Mhm.
I think also I'm a, what I would consider a neuro-based physical therapist, and
Okay.
most pediatric issues are neuro-based. It's not like an
Mhm.
injury; it's more developmental or something that happened during birth or in utero developmental, and that's all neuro.
Oh,
So.
wow. Okay, awesome. So then tell us a little bit about what happened leading up to you finding out that you were pregnant for the first time, and then we'll kind of like lead into the rest of your birth stories from there.
For sure. So I did have a blighted ovum before the first pregnancy, so I had a little bit of loss going on there. When we got
Okay.
the second time,
I'm sorry.
oh, that's okay. That there's going to be more. Um, I got pregnant the second time. Everything was going very well. I was super excited. Couldn't wait. Had everything that the due date planned out, and gonna figure
Mm.
all this planning. And then I was on a trip to San Francisco to visit my best friend, and she had just had her first son.
Oh,
And
wow.
I received a phone call from my doctor that my AFP levels were through the roof, like completely abnormal. And
Mm.
so I didn't understand what that meant. Was very confused at that point, but she said that, well, that could either mean you're further along, or perhaps you have twins, or perhaps there's an issue, so we need to have you go for a level 2 ultrasound.
Okay.
So when I came to Denver, my husband and I, we scheduled the appointment. We went together to the
Mm.
clinic,
Hmm.
and I could see on the ultrasound picture above that something didn't look right. I didn't
Mm.
quite know what was wrong, but the baby's body just looked very different. She was bending backward, the wrong direction. And
Mm.
when they read the report to me, when the radiologist came in, he basically said she's incompatible with life. So that I can, like, as I'm talking about that, I can visualize him standing there telling me that my daughter is incompatible with life.
Wow.
And so we decided through that the pregnancy was not viable. And
Okay.
they asked if I wanted to have the DNC or if I wanted to have deliver her, because by this time she was 16 weeks, 17 weeks a gestation. So
Mm.
I felt like she was big enough I didn't want to just have the DNC, which I respect people who want that choice.
Yeah.
That's perfectly okay. Um,
Mm.
but for me, I felt like I wanted to deliver her. So she was 18
Okay.
weeks. We went to the hospital to deliver her, knowing that she wasn't going to make it.
Mm.
Um, and so we went through the delivery. It was a very long delivery. I had to have a lot of Cervidil and uh, Pitocin. I couldn't take it anymore. I started shaking, and I couldn't like breathe. And so that they said, really just need to have an epidural at this point. Well, obviously my body wasn't ready to birth her. She was only 18 weeks.
Right.
So, so I had the epidural placed, and that was a really hard experience, because I couldn't feel my legs, and I've never had an epidural before, and it was
Yeah.
just very. It didn't help me calm down any.
Mm.
So anyway, we birthed her, and the staff was great. And, they brought her to us in a little blanket. They covered all of her up. What had happened was that her ventral wall didn't close. So
Mm.
as the baby developed, you should kind of give yourself a back and a front, and
Yeah.
that didn't close at all. And so all of her insides were on the outside.
Okay.
And that's why she presented the way she presented on the ultrasound, looking like she was a jackknife, because she had nothing to hold her front in.
Okay.
So it wasn't like an aphamocele that could be repaired. And that was why they said that she was incompatible with life, that there wasn't a small hole that had part of her intestines out or something like that. It was
Mm-hmm.
everything from her diaphragm down.
Okay.
And so they kept her covered, and we got to hold her, and they made a little memory book for us, and they gave
Mm.
us the bear that she was with, and
Mm.
that was really nice. They sent us home with a meal. The thing that I didn't even think about, if we birthed her, then what do we do with her now?
Yeah.
Well, because she was 18 weeks, the hospital took her. If she would have been older than 20 weeks, we would have had to make funeral arrangements.
Oh, okay.
So if you ever are in this experience, you might want to know what the dividing line is when it's your responsibility to take the baby. And
Right.
so I didn't even think about that, and I wasn't prepared for any of that. So the fact that the hospital could take her was a relief to me.
Yes.
So they sent us home with a meal, and they did
Mm.
offer us some counseling, and which I took them up on that.
Okay.
And of course, then at that point, I was on this quest of what went wrong. What did I do? What is wrong
Okay.
with me? Why can't
Mm.
I get pregnant with a baby, that it's going to be okay? And so I did a beginning of this journey of like improving my health and wellness, and trying to bring in
Mm.
medicine. I was trained as a level 1 Reiki. I started going to acupuncture. Uh,
Mm-hmm.
and trying to change my diet. They were telling me that I had too much yin, and the opposite. I had too much yang, and I needed more yin to balance me out and create
Mm-hmm.
a garden. But then I'm trying to control the situation. So then we spent a lot of time, like I had a really hard time getting pregnant that again, just because I felt like we had to do it now. And what I realized is the more control I tried to have, the less things were working.
Mm.
And
Mm-hmm.
everybody said, just stop worrying about it. It will happen. And I couldn't wrap my mind around, what do you mean stop worrying about it? I have this ovulation window.
Right. Yeah.
I need to worry about it now.
Right. Right. Right.
But through my own self-discovery, that advice was actually true. I just wasn't in a place to listen to it.
Yeah.
And I had to come to that place on my own, and to realize
Mm-hmm.
that the more I was controlling the situation, the less help I was having, success I was having.
Mm.
Anyway, so we did get pregnant again. Then that following spring, so that was good. Which it actually wasn't that long if you think about it, but in the
Yeah.
moment it seemed like it was a long time. So
Okay.
that pregnancy, I was very nervous and very anxious. In fact, they had given me folic acid, 4 milligrams of folic acid to take every day, because they were thinking it was a neural tube defect. So perhaps I'm not absorbing the folic acid. Well, that folic acid made me so nauseous. I was nauseous from the day I started taking that 4 milligrams. Usually the recommended dose is 800 micrograms. So 4 milligrams is a humongous super dose, but to prevent any potential neurotube defects. So I dealt with that nausea until the day he was born, and he was perfect. He came out, in that birth, was in the hospital. Again, still leading up to that, as soon as I could feel contractions, I started counting them and counting the length between them, and wait, those are just Braxton Hicks, and that's not a real contraction, but I don't really know what a real contraction feels like. So every single time something was different, like, oh wait, this is it. And so there's a lot of anxiety, and I didn't have the tools at that point to deal with anxiety. I didn't even really recognize that I had anxiety, but I did. And so I had 2 falls during that pregnancy. I fell on my butt one time, and then one time I was walking an adult patient up the stairs, and he fell backwards on top of me. And that was at 37 weeks. So I drove myself to the hospital. And then because I was having contractions, it was 37 weeks. They kept me overnight, but he wasn't ready to be born yet. He stayed in there until 40 weeks, 5 days, which is another thing that I didn't understand. Like, I thought your baby came out at week 40. That didn't happen. So that birth, the actual birth in the room, I didn't know what I was doing. Great nurses, again, same hospital that I delivered my daughter at. Wonderful hospital, didn't know what I was doing. So we got there, when I realized in the middle of the night that this was actually very different. The contractions were completely different than what those Braxton Hicks felt like. I told my husband we need to go. And so we got there about 2, maybe 1 in the morning, and he was born at 5. So it wasn't a very long labor. But during that labor process, it was like a lot of hold your breath and push, and keep pushing, hold those knees back, and I did it, and I tore because I listened to the nurse, and I, instead of listening to my body, stayed flat on my back, and I didn't know what to do. So I had I took a hypnobirthing class at that point. So that sort of had given me some tools as far as try to breathe the baby down. But in the moment, all of that went out the window. So it was nice to have that. But when it came down to the end, and I was like, gonna go without the epidural, that's fine. And then I remember them saying, to me, like, okay, are you sure you don't want the epidural? Do you want something? They gave me some fentanyl. Well, the fentanyl didn't touch it at that point. It didn't matter. But of course, knowing through the hypnobirthing class that's you're supposed to get to that point at the end. It's okay to get to that point at the end. And knowing that I did it okay, like, fine, this is hard, but I'm going to get through it. And the nurses helped me do that. Yes, I tore, blah, 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 but I had my baby and things were fine. My recovery for that was pretty good. My first baby that I got to take home with me, so I was over the moon. I remember being in the bathroom. Baby was in the little bassinet that, I can take a shower now, and thinking to myself, he's mine. I don't have to give him to another parent, like, because, from a babysitting perspective or from a pediatric therapist perspective, the baby goes with somebody else. I'm like, oh, he's going to come home with me. So that was fine. The first 4 months were hard, just because you don't know what the baby wants, and you're up all the time, and it's just stressful, right? But we went on and got pregnant again 4 years later. So that one took a lot longer. It took us 4 years before we got pregnant with the second one. Well, he was born 4 years later. But again, trying to like figure out how to get this right. How do we not repeat the first one, but not be so anxious as we were with Ryan, who was my son. And his birth story was different in the sense that I would never consider inducing with my first son, just let it happen. But he, 40 weeks, 5 days. And so, come on, this second one's going to come a little bit faster because I've done this before. My body knows what to do. No, your second one doesn't just come faster. And still he was, 40 weeks and nothing. So it was over a weekend, and they were like, we can induce you anytime now. It's fine. You're past 37 weeks. He's looking good on the screen, but if you want to be induced, no worries. So I was going to have them induce me on a Tuesday, but that Thursday I called and said, is there any way we can just do this tomorrow? Because I don't see a reason to wait. If he hasn't come out now after 40, let's just. So that was February 28th. And so that would have been, if he was born the next day, which was actually the 29th that year, he would have been a leap year baby, and that's fine. But I told him to come out on the 28th. And so the doctor, they're like, okay, we're going to induce you, come in at 8 a.m. And this is going to be hard and fast. I'm like, well, can't you turn it down if he starts to progress? No, full court press, we're going. So, and I guess medically, that's what they do. They don't titrate the Pitocin. You're going to go, you're going to get it, and it's going to be done. So, okay. But we went to the hospital between 8 and 12. Things were easy, walking around, no big deal. At noon, things started changing. The contractions started getting longer and harder, and significantly harder than they were with my first real delivery with Ryan. And he was born at 2 o'clock. So it went from 12 to 2, hard and fast. But I felt like I really had a good knowledge that I didn't have to lay down, that I could be standing over the bed. And I realized that if I stood and I kind of rocked side to side, that really was comforting during the contractions. And I was using my breathing, and I had my meditations from my hypnobirthing class that I was using. So I felt much more prepared, that I didn't have to listen to what the nurse wanted me to do. I did feel like I had more control. So that was fine. His birth went fine. I didn't tear with him. And so great. Now I've got 2. That transition was pretty difficult. I started having symptoms of ADHD, and I talk pretty fast and I talk pretty loud just anyway. And people just said that was my Italian heritage. So I talk with my hands and I'm super fast. But I think really as a kid, I probably did present with ADD or ADHD, and just never had it diagnosed. So now I'll call it a birth that is a trauma for me. But that was the first sign that something was different in my nervous system, was after the second one was born, and I started being very scattered, and they're just saying, oh, it's because you're a mom. And that's what I chalked it up to be. So when my second son was maybe he was about 10 months old or so, my husband's like, I don't remember anything about the first few months, and he's almost a year and he's getting so big, and I think I want to have another one. I'm like, are you sure? Can I get this on recording? Because I want another one, but are you sure you want 3? And so he agreed. And so we actually got pregnant pretty fast. And so maybe, again, thinking about it, I didn't have any preconceived notions about this baby has to be born by this date. Here, I think I'm 40 or just about to turn 40 at this point, that I need to have this now. So just knowing that, was she conceived so quickly because I didn't try to make it happen? I don't know, but it happened a lot faster than 4 years. So, so that pregnancy, I decided we're actually going to have a midwife. And so we didn't go with our traditional insurance. I wanted to have a home birth. And so we had a midwife start to finish, and we had a home birth. And yeah, so big difference. Didn't want to be in the hospital. I lived close enough to the hospital that if something did go wrong, I felt like we could make it in the 15 minutes that would take us to get there. So the home birth was always the plan. I could have her in the pool in Colorado, at least in 2008, 2010, and those you couldn't have the baby in the pool, in the tub. You can be in the tub for labor, but you'd have to get out to deliver the baby. So for me to have a water birth was something that I wanted to experience. And so the only way to do that was to either go to a birthing center, and even there, I don't think you can have the baby in the water or have a home birth. And so I opted for the home birth. And so that was much different in the sense of the philosophy of the midwife, and just kind of what she wanted me to focus on. Like, she actually wanted me to gain weight. She wasn't concerned that I was gaining more weight, and she wanted to make sure that I was eating healthy fats. And so a very different philosophy. She had me do journaling. She had me, so very different than going into the clinic, and a welcomed experience, very welcome experience. So the same thing as far as knowing when is this happening. I went to acupuncture to try to get the baby to come out because it's still 40 weeks. In fact, I was with an insurance company that would have had you go to their hospital and clinic, and on 40 weeks and 6 days, they're like, you need to come in and have the baby. Like, we don't want you waiting anymore. So acupuncture again. They think that my water broke the night before, but I was still very pregnant and not really having any active contractions. So I had the midwife come over for an extra visit and try to do some digital stimulation to try to massage the cervix and try to get things moving. And then about 3 hours later, I started having real contractions. So didn't have to go to the hospital. What she thinks happened was I maybe had 2 bags of water, and the first bag of water broke, and that's why I wasn't really having contractions. So anyway, but so fine, labor happened. I was able to kind of move from my couch during contractions, and I did spend some time in the water, and I got out. By the way, right now, physically in this present moment, I have like goosebumps at this time. So just so you know, like, I'm like kind of reliving this and having like a reaction to talking about this. So so I was able to get in the water for a lot of it. And the doula had a student with, not the doula, the midwife had a student with her, and she just sat upstairs in my living room. And I said, well, how will you know when I need you? And she's like, I'll know. Like, okay. So she just let me and my husband kind of work it out. And then it changed. My breathing changed. I couldn't talk, like as far as having to focus so hard on, and she could hear the different breath, like more of a back, like an Ujjayi breath for yoga. You're like, so she came down with her student and facilitated the birth, and I was able to birth her in the water, and that was great. And then I had, she had saved my placenta. She had made me a smoothie with my placenta, which is not very tasty, even with all of the blueberries and strawberries. But I got it because was really important to me to do that, and to also be able to encapsulate my placenta, which is something that I didn't do for the first 2 births. So I was able to encapsulate my placenta. And that transition was the best transition from 2 to 3, but it was because of my mother-in-law. My mother-in-law came and stayed with us for 6 weeks and really helped me have that transition. When she left, I began to stutter for an entire year. So again, noticing what happened to my nervous system. And then people would just said, well, you're just stressed. You've got 3 kids now. I'm like, I know, but this is strange that I can't like get out a full sentence. Like I would not be able to talk to you. It was not so much at work. It was much more in the home. So I did feel like it was stress related, but I couldn't get out a sentence. And so I that was for an entire year that happened. Um, so that was 4 births, 3 keepers, and Marie who passed, but we still celebrate Marie's birth every year. We still have a candle vigil for her, and we look at her pictures, my husband and I. But then I was 41 and something, and I decided I wanted to be a surrogate for somebody else. So I said, they don't accept you as a surrogate if you're older than 42. So I was like, well, I need to do this now. And if it works out, it works out. If it doesn't, it doesn't. I was rejected by the first company agency because of Marie's birth, because of that neural tube defect. And because my husband and I have gone to counseling before, they also didn't like that. Like, well, isn't that a good thing but they didn't like that. And so they rejected me. And if there's enough surrogates that they can choose from, it was maybe a smaller surrogacy agency, then fine. So I said, well, I'm going to try one more surrogacy agency. And after my profile was posted, I was accepted by a couple in London within 12 hours. And so I went on to have a baby boy for these dads. And the pregnancy was great. Again, like I know what to do. The births, I can do this. I can birth babies. I can birth babies in my house. I've got this. The birth, again, best laid plans don't always go that way. This was not my baby, and so this was somebody else's baby. So they had a little bit more say and control of when baby comes out. I'm now 40 plus, 41, and advanced maternal age. And so after 37 weeks, the risk to the baby was greater. They would not let me go past 37 weeks, or maybe 38. I think they gave me 38. He wasn't coming because my body doesn't give up babies until 40 plus, even if it's not my bun. It didn't matter. I wasn't, and so I was induced again. All day long, the Cervidil didn't work. The Pitocin didn't work. Like my cervix wasn't ready to give him up. Because remember, even with Ryder, even when I had the induction with Ryder, I was still 40 weeks, and he's only 38. So this wasn't happening. So long time, long labor. I managed well until I didn't. Started shaking again, started like feeling like I can't do this. I was good until I wasn't. So again, those catecholamines released, everything that I learned in the hypnobirthing class of staying calm, staying relaxed, let your body do it. I stopped. And so now he's not coming down. The doctor's like, you really should have progressed further by now. And I felt like a failure because I wanted to have this experience. I've done this. I can do this. And I really felt bad. And again, wanting to give the best for this baby who isn't mine, but I was hired essentially to birth this baby for this family. And I felt really bad about that I was not going to do it the way that I would have wanted it for my own child. But they didn't care. They just wanted their baby. They didn't care whether I had an epidural or not. They didn't care, just whatever you need. So I was able to like sit with that for about a half an hour or so, and the contractions were coming faster, and to the point where I was feeling like this is enough after how many hours of labor this was, over 12, 14 hours of labor. So I agreed to have the epidural. But when you have an epidural, if you haven't had one before, they sit you at the side of the bed, they have you bend over, and they tell you not to move. but you're still having contractions. So go ahead and don't move, but you're going to still have contractions. And so I was 6 centimeters at this point, dilated, and I couldn't not move. And the anesthesiologist got pretty mad at me for not moving. And she's like, you have to stay still or I can't do this for you. So I stayed still. I grabbed onto my husband's legs as he was down below me, and I stayed still and pushed through that contraction all the way to 10 centimeters. So I went from 6 to 10, sitting at the edge of the bed. I got my epidural now. So the rest of it was easy because he's coming and I can't stop it. He's crowning as I'm sitting at the edge of the bed. But they laid me back and he was born. So hooray, gave him to the dads. It was beautiful. They got to cut the cord. He was up on my chest for a little bit, but I wasn't going to be breastfeeding him. So dads took him. In fact, I was going to try to express some colostrum, but that was that didn't work. And I didn't talk about my breastfeeding issues before, but that's okay. That was a whole nother, we could talk about that another day. But anyway, they were able to get their baby. He roomed next to me. And so I was able to see him. And even to this day, even though they're in London, we still Skype about every 6 to 8 weeks. So he's now, he'll be 2 on September 9th. And so, yes, it was a really good experience. I'm very happy to be able to do that. And everything was perfect for him. Cute little baby. But then, again, that was another trauma. And I started sleeping, and for those of you who are listening on this podcast, legs crossed, arms crossed over one another, and I couldn't sleep any other way. So this is a recovery position for a reflex called Moro. So developmentally, my body went into protection. And I didn't understand what was going on, like why I needed to, I felt like I was like a corpse every night, that I had to sleep crisscross with my legs and crisscross with my arms. I could not sleep any other way. And so thinking about this now and actually learning more about primary reflex integration, what happened was every single birth I had, it was another traumatic event that set me back. But I didn't know, and I wanted these babies. And it wasn't a negative trauma in the sense that something was horrible happening, but because of the loss of Marie and because of which is what we named my first daughter, we didn't really appropriately grieve, or my nervous system didn't appropriately move past that trauma. Every single time, including the ones that didn't belong to me that I gave away, was another hit. And so my nervous system, whether it was symptoms of ADHD, starting to stutter just randomly, now in this recovery position, my startle reflex is very heightened. So I'll even scare myself. If I drop something, the noise of that, I'll scare myself. At this point, I'm still in a recovery, even 2 years out. I don't sleep like this anymore, but if somebody touches me and I'm not expecting it, I vibrate. So I'm working on getting my nervous system back. I will not be having any more babies. I love my children. My oldest actually is 12. So I've got a 12-year-old, an 8-year-old, and a 6-year-old, and they're plenty busy enough for me. There won't be any more. I'm working on me now and trying to heal that. I wouldn't change it any other way, only to acknowledge that even a positive event as a birth can still be a trauma. Even all the plans I had, and even having the home birth, and it was a beautiful birthing experience. And again, I wouldn't change anything, was perceived as a trauma in my body. So that's my story.
And Christine, if you could give expecting parents like any advice from your journey so far throughout parenthood, what would you give as advice?
my advice is we don't have as much control as we think we do. And resistance is always met with resistance. And whether it's with your birth, or you're trying to get pregnant during the birth, or your children as they grow, releasing control, creating some space between what is happening and your response is the best thing. So the opposite would be something happens or you experience something and you want to control it. That's that resistance that you will always be fighting against until either you push it over, it pushes you over, or you learn to create that space. And that's what I naturally found, and why I think we got pregnant quicker with my fourth pregnancy, was because I wasn't pushing up against these must-dos, should-dos. I had released control to the best of as I could at that point, in my understanding of what was going on. But all the time I was thinking I had to be in control just created this resistance of, this isn't happening, this isn't right now. And that was a really hard lesson to learn, but I see it over and over and over again. So that's my advice.
Okay. And Christine, I want to thank you so much for sharing all that you have with us about your life and your birth stories and everything too with your surrogacy and your husband and how you guys reacted throughout the process. I really, really appreciate your transparency and your honesty in sharing a lot of things that are, really personal and for a lot of people are really hush and that they don't share about. So thank you so much for being so open. And just let everybody know like where they can find you online, and if you do offer like virtual support within your profession, definitely let people know that too.
For sure. So during this process, I kind of have turned away from traditional physical therapy, and even though I'm a physical therapist, but trying to take it in from more this neuro developmental perspective, and have also found yoga and how yoga and meditation can help us with this nervous system. And the research is there. So to help how we can grow our brain, how we can do better at creating this space between impulse and action. And so that really, this morning I did not meditate since I'm talking with you here, but usually I do my meditation every morning. I'm beginning a more active yoga practice, again, to help notice and be aware of what my body is telling me, instead of just shutting it out and doing what I want anyway, which is, I think, what I live most of my life is like, I'm feeling things, my body is telling me no thank you, but I'm going to do it anyway. And it very well may be the case that I could have done all those things, but being able to be more respectful about actually how I'm managing, like thinking about having the third child, maybe that wasn't the smartest choice. I love my children. I love all my children, but really for me, knowing what happened after the first 3 births, thinking about that, was that the right choice, or should I have done some work for myself a little bit more? Like what is going on with having more children and more responsibility, and how is that changing me, and am I okay with that? I just wanted that third child. And again, I wouldn't change anything. If you really want that third baby or fourth baby or however many you want, go for it, do it. But understand where you are and what's happening. Do it for you, not because somebody else or you think that society wants this or your parents want this for you, or I don't know what else, those external factors. Do it because this is what you want, and you're going to be able to notice and respond to the cues that your body is giving you. And my body was pretty strongly telling me, I don't like this. I did it anyway, and now I'm paying the price of trying to reorganize myself so that I can take care of them. And anyway, so that, and you can find me online. I have a website called Sweet Pea Pediatric Wellness. I'm also on Facebook in the same Sweet Pea Pediatric Wellness. I have a podcast for dyslexic learners and a dyslexic adult. So if anyone's listening might be dyslexic,
because I love that idea.
Well, Anyway, and transparency, like if we don't talk about this, you bottle this up inside and you think that you're the only one who have had this. So your podcast, Ariel, is so important to be able to get these voices out there and to understand we are not alone, that these experiences are not isolated cases. Yes, they're hard to talk about, but it is part of the healing process. Obviously, talk about it with people who you care about. This is very vulnerable subjects, so we don't want to be telling people who might be looking down on you or make you feel worse about yourself. But if you can find a community of other parents, being on a podcast, telling your story, journaling to yourself, you don't have to be announcing it to the world, but get it out of your head. If you have any loss or trauma, get it out of your head and put it someplace else so that you don't have to carry that burden by yourself.
Yeah. Well, Christine, I want to thank you so much for giving us your time and your expertise and your wisdom and sharing your full story with us. And I will definitely link how you can find Christine online in the description. So if anybody wants to listen to her podcast, if you do want to take advantage of her meditation and yoga support, if you do have questions about pediatric therapy, I'll list all of that below. And thank you so much again. I really appreciate you.
Yay, thank you.